When you're conducting scenarios, this is a huge leadership opportunity, and you must be able to conduct safe and effective ones. Because scenarios should take place outside, there are some basic teaching tips you should follow to help participants hear and understand you in this learning environment. For example, face the sun when you are talking to participants. This will allow them to see your face. You want to be sensitive to noise levels that can be generated during scenarios. For example, walking over dry leaves in the fall. If you are walking and need to address the group, stop and move to the middle of the group and address everyone together. Participants need to know the story behind the scenario to participate fully in it. In many cases, this means providing participants with as much detail as possible before the scenario begins. However, you also need to be prepared to provide additional information or repeat the details of the scenario as needed to accommodate different learners. Do not change the rules or the story as the scenario unfolds. You'll want to prepare all scenarios beforehand, including individual roles. Content for creating cue cards for each scenario is provided in Appendix 310 of the Instructor's Manual. If you turn to page 193 of the Instructor's Manual for an example of the contents for cue cards, what information do you see that the cue cards provide? Ideally, you see the action the participant should take to help the scenario take place. If you turn to page 71 of the Instructor's Manual, you'll see one of the activities that corresponds to the cue cards. What other roles are necessary for the scenario? A leader or a lead responder, a note taker, and certainly a patient. In addition to the leader and patient, you might assign a note taker for each scenario, using the Wilderness Remote First Aid Report Form or Rescue Request as a guide. The note taker observes the group's actions and shares his or her observations during the scenario follow-up. Consider providing the note taker with suggestions on what to look for, especially for those early scenarios. This is also a great way for you to identify things as an instructor that will be helpful to the group later. Scenarios tend to work best when they are limited to about 6 participants. If your course has more than 6 participants, you should consider adding more roles to the scenario. Because of the unique environment and the complicated nature of scenarios, 2 or more instructors are preferred, especially for groups larger than 6. You can also add additional roles to make the scene as realistic as possible and meet the needs of the participants. What additional roles would you assign to help make the scenario realistic? Right, someone who disagrees with the leader, maybe a person who declines to help when asked, or a person offers to help but does so incorrectly. This challenges the group and the leader to identify what's going on in real time. For additional roles, create your own cue cards, or privately provide information to the individual role player. That is, do not allow the responder to know about the role, so the responder can react to the scene as he or she discovers it. Prepare any equipment in advance, including props and any moulage supplies you may choose to use, to make the scenarios as realistic and safe as possible. When setting up scenarios, make your challenges for the group and expectations for participating in the scenario clear. Focus the scenario on the associated lesson objectives. What is an example of a way that you can focus the scenario on the associated lesson objectives? For instance, if the lesson is wounds and wound care, you might use a moulage kit to simulate a wound. You want to remind the participants of your expectations for the scenarios, moving in rapid speed, or being more observant of the written materials. You also need to sequence the scenarios to come after many lectures. Arrange the scene so that it requires the group to perform the intended action. For example, if the lesson is head, brain, neck, and spinal injuries, have the patient lying in an awkward position on his or her side. Provide the patient with cue cards that provide actions to perform that highlight the intended action of the responder. If you predetermine a suitable location for a scenario and take the steps to keep it safe and comfortable for all, you'll have much greater benefits. what are some of the ways you can take steps to keep the location safe and comfortable for all? Well, you might need to intervene in a skill, meaning you might have to place insulation under the patient if the group does not remember to put insulation under the patient if it's appropriate. You also might need to stop an activity if the scene becomes unsafe. For example, someone walking over the patient or trying to use an improvised stretcher that is unsafe. Remind participants of your expectations for the scenario. When conducting scenarios, you must provide participants with a clear way to signal if something is wrong. Everyone should be informed of the signal so that the scenario can be immediately stopped if necessary. This could be a whistle or some other word. You should also give participants who are playing the role of the patient a word to communicate pain that is being simulated. This allows them to stay in character without causing people to think they are experiencing actual pain. I believe we were using hippopotamus. But it could be any word, and if they own it, they'll use it. Participants can use whatever they have brought in their first aid kits and/or packs, but you could choose to remove certain items or render them useless. For example, remove any SAM splints to encourage participants to come up with an improvised splint. During a scenario, encourage participants to look beyond the issues of demonstrating just a first aid skill to the larger context of the delayed help situation, which includes utilizing available resources and taking into consideration the situation at hand. For example, with splinting, this means describing or demonstrating long-term care. That's RICE, or cleaning the wound. Thinking back on some of the things we discussed earlier, what are some of the ways you can encourage participants to look beyond the skill to the larger context without telling them exactly what to do or stopping the scenario to discuss? Well, you can remind participants how the scenario fits into the course objectives. You can restate the activity's instructions and/or your expectations. And if you have each scenario build upon the prior learning experience, you can include those previous scenarios within it and create more of a story. You can provide a hint or a tip to a scenario participant who is not at the moment actively involved in responding to the situation, who can then share the information with the group. As you observe the scenario, your focus should be on watching the performance of the participants as well as group dynamics, observing the first aid skills they are using, identifying and recording key points from the lesson that should be re-emphasized during the scenario follow-up based on the group's performance using the Wilderness and Remote First Aid Competency Check Sheet, managing time so the scenarios do not run longer than planned, monitoring safety and stepping into the stop any activity if the scene becomes unsafe or no longer educationally effective. Participants will more than likely have difficulty providing the appropriate care during the first scenario. They may also have trouble adjusting to the scenario environment and may ask frequent questions or ignore your attempts to make the scene seem real. During the early scenarios, leaders are frequently reluctant to make a decision without input from the group. In this situation, try to push the leader to make timely decisions. It is also common for one person to dominate, in which case you should appoint a leader for each scenario or build the expectation of allowing everyone to be a leader, patient, and note-taker at some point. Leaders may initially tend to focus on first aid and leave the group to fend for themselves, or neglect to account for environmental dangers. Provide these leaders with timely and frequent updates or reminders of conditions so they can manage the situation, not just the care. In early scenarios, leaders may also go to the call step without enough information needed for rescuers, or they may rely too heavily on cell phones. So how could you address this? Well, if you noticed on the course, we reinforce the need for completing the Wilderness First Aid Report form and rescue request. You can also act as the emergency medical services operator and request this information during the call for help. You might also remove cell phones from their first aid kit and or backpacks. Make the rule that there is no cell phone service at the location of the scenario. Groups may act too slowly during early scenarios and frequently interrupt scenarios to ask questions or stop to look things up in their pocket guide or emergency reference guide. You may need to push participants to stop them from taking too much time if this delay would interfere with care while being careful not to discourage them from appropriately using these resources. Facilitate scenarios by using push and pull techniques. For example, in some cases it may be better to allow the group to discover the details of the scene as they unfold, such as by placing an index card on the patient's body that tells the responder that lightning has just occurred. In other cases, it may be more appropriate to give the group certain information more directly, such as telling the responder the patient's pulse when you see him or her take it, and providing updates as the scenario unfolds. And by the last scenario, rescuers should be acting in real time. You may need to encourage this by prompting the group to shorten their reaction time with each scenario. Alright, as we get to next Saturday, we'll also be looking at moulage and how to use that to bring up the level of